This video will talk about the differences between Wernicke's aphasia and Wernicke's encephalopathy. These are two different neurological disorders. However, the only thing in common is the German neurologist called Karl Wernicke who described both disorders. Starting with Wernicke's aphasia, it can be defined as the inability to understand spoken language. However, the patient's ability to speak is usually maintained. It results from a lesion that affects the posterior aspect of the superior temporal gyrus, an area which is supplied by the inferior division of the middle cerebral artery. Now, let's imagine a conversation with a patient with Wernicke's aphasia. For example, you can ask him about his name, but he will respond by talking about the weather. Patients with Wernicke's aphasia can have impaired reading as well. Now let's talk about Wernicke's encephalopathy. This results from thiamine deficiency as a result of malnutrition, alcoholism, or bariatric surgery. Pathologically, there will be neuronal loss, demyelination, and gliosis that affect the medial thalamus, cerebral periaqueduct and mammillary bodies, and sometimes the cerebellar vermis. Clinically, it is characterized by a triad of ophthalmoplegia, acute confusional state, and ataxia. Sometimes the patient can have peripheral neuropathy and macrocytic anemia. Treatment is by parenteral thiamine administration for several days. It should be given either before or with dextrose in order to avoid exacerbation of thiamine deficiency.